Greetings, everyone. This is the Gardening Snail of Livingston, California. I've been keeping track of COVID-19 statistics since the outbreak began. These are some of the numbers for the week ending July 31st. But before we get into that, the debate begins for who's first in line for the COVID-19 vaccine. NBC New York reports, U.S. health authorities hope by late next month to have some draft guidelines on how to ration initial doses. Traditionally, first in line for a scarce vaccine are health workers and the people most vulnerable to the targeted infection. For all the promises of the U.S. stockpiling millions of doses, the hard truth, even if a vaccine is declared safe and effective by year's end, there won't be enough for everyone who wants it right away, especially as most potential vaccines require 2 doses. In the U.S., the Advisory Committee on Immunization Practices, a group established by the Centers for Disease Control and Prevention, is supposed to recommend who to vaccinate and when, advice that the government almost always follows. But a COVID-19 vaccine decision is so tricky that this time around, ethicists and vaccine experts from the National Academy of Medicine, chartered by Congress to advise the government, are being asked to weigh in too. The CDC's opening suggestion: first, vaccinate 12 million of the most critical health, national security, and other essential workers. Next would be 110 million people at high risk from the coronavirus, those over 65 who live in long-term care facilities, or those of any age who are in poor health, or who are also deemed essential workers. The general population would come later. Beyond the health and security fields, does essential mean poultry plant workers or school teachers? And what if the vaccine doesn't work as well among vulnerable populations as among younger, healthy people? It's a real worry, given that older people's immune systems don't rev up as well to flu vaccine. If you want more on this topic, check out the link below this video. In more local news, Fox 26 News reported that Governor Newsom blocked nearly $65,000 from Atwater in Merced County and more than $35,000 from Coalinga in Fresno County, the first installments of $2.5 billion in federal funds that cities and counties across the state risk losing if they don't toe the line on coronavirus safeguards. Atwater is eligible for $389,000 and Coalinga for $216,000 in assistance through the state's coronavirus relief fund. On Monday, Newsom announced he would spend $52 million in the Central Valley to improve virus testing and provide other help to residents in the agricultural region that has a high population of Hispanics, a group disproportionately harmed by the virus. The state is also sending strike teams of healthcare workers to help hospitals handle the additional cases. The Merced Sun-Star reported, can you get a coronavirus test in California if you want one? Well, it depends. California officials say it's no longer possible for everyone who wants a COVID-19 test to get one because of lab delays and supply shortages. So, who can get the test? That depends on where a person ranks under new guidance the Newsom administration unveiled this month for testing sites and labs to determine whom to schedule for testing and which samples to test first. Hospital patients with coronavirus symptoms are the highest priority, along with people public health departments believe are connected to an outbreak. According to the California Department of Public Health guidelines, Tier 1 priorities include hospitalized individuals with COVID-19 symptoms. Investigation and management of outbreaks under direction of state and local public health departments includes contact tracing. Tier 2 priorities: all other individuals with COVID-19 symptoms, close contacts of confirmed cases, individuals who have no symptoms but fall into certain categories. 1. Living in high-risk care facilities. 2. Healthcare workers with frequent contact with the public. 3. Working in a congregate care facility. 4. In-home care providers to the elderly or disabled. 5. Emergency service providers and first responders. 6. Work in a correctional facility. 7. Patients requiring preoperative pre-hospital admission screening. 8. Patients being discharged from hospitals to lower levels of care. Tier 3 priority: the following individuals who have no symptoms and fall into one of the following categories: work in retail, work in food service, work in agriculture or food manufacturing, work in public transportation, or work in education. Tier 4 priority. Tier 4 would be implemented when the state's testing turnaround time is monitored by CDPH is less than 48 hours. Other individuals not specified above, including those who are asymptomatic but believe they have a risk for being actively infected, as well as routine testing by employers. Testing, discrimination, and inappropriate workplace testing. As modifications are made to public health directives and more sectors of the economy open with adaptations, it is important that employers do not use testing to impermissibly discriminate against employees who have previously tested positive for COVID-19, such as by preventing them from reassuming work after they can do so in a manner consistent with public health and safety. This does not mean an employer must allow an employee who currently has COVID-19 to return to work before the employee's infection is resolved. Further, because PCR tests can remain positive long after an individual is no longer infectious, proof of a negative test should not be required prior to returning to the workplace after documented COVID infection. Rather, symptom or protocol-based criteria should be used in determining when an employee is safe to return to the workplace. Yes, you still have to get your kids vaccinated even if their California school goes online, as reported in the Sunstar. Despite the pandemic forcing California kids behind a screen at home for at least the start of the year, State Senator Richard Penn, the Sacramento Democrat who wrote both vaccine laws, said the regulations still stand. The Department of Public Health also confirmed that immunization requirements for schools haven't changed. In county news, the Sunstar had an article about county supervisors taking a pay cut in response to the impact of COVID-19 on the county budget. And it reads, amid economic pains caused by the coronavirus pandemic, 4 of Merced County's 5 Board of Supervisor members chose to refuse an automatic salary increase. District 4 Supervisor Lloyd Perea declined the raise, while Supervisors Rodrigo Espinoza of District 1, Darren McDaniel of District 3, and Scott Silvera of District 5 each opted to reduce their pay by 5%. The Monday, July 27th dashboard update. Total confirmed cases rose to 3,510, up 265 from the previous week. 2 additional deaths were reported, 2 males between the ages of 50 to 65. Total confirmed cases climbed by an additional 253 on the Tuesday, July 28th report, and another 143 on the Wednesday, July 29th report. There were 6 additional deaths confirmed, 5 over the age of 65 with underlying health issues. July 30th saw another increase by 159 confirmed cases, and an additional 4 deaths related to COVID-19, 3 of them over the age of 65 with underlying conditions. By Friday, July 31st, total confirmed cases had risen to 4,285 and total deaths to 50. According to the County Department of Public Health received additional data from an out-of-county hospital that had COVID-19 associated deaths of Merced County residents, and this adjustment accounted for the spike in total deaths. This spike included 11 deaths, and it is not known if any had underlying health conditions. As of the weekend, there were 23 active outbreaks, including residential homes, assisted living facilities, and medical care operations. Here we have the 5 reporting days at a glance. You can see how positive cases rose from 3,510 to 4,285, and probable active cases rose from 1,428 to 1,882. The pink area in the bar graph represents the time period from July 1st through July 31st, in which probable active cases rose from 610 to 1,882. Because of the scale I've been using, it is off the charts. The table shows the reporting week alone, total positive cases rose by over 1,000 to end the month of July with an increase of 3,221 positive cases. There were 23 additional deaths reported in just this week alone. Merced, Atwater, and Livingston had the largest increase in positive cases for the week. I'm going to wrap this up today with a public comment made by a local pediatrician at a recent Board of Supervisors meeting.
And before folks speak, if you could state your name, that would be great.
Absolutely. I'm Seema Asadi. I was really nervous coming in here, but now that I look around and see so many familiar faces, people who trust me, I feel like I can calm down a little bit. Dear members of the Board of Merced County Supervisors, Merced County Board of Supervisors, as some of you know, I'm Dr. Seema Asadi. I've been a community pediatrician in Merced for over 20 years. I am also the product of an in-person public school education from kindergarten through medical school. I have spent many hours over the last 5 months studying, reading, analyzing, going through papers, all related to COVID-19 and how it impacts pediatrics. It is to some degree bold of me to say, but I want you to consider me your local expert on pediatrics and COVID-19. I have done my homework. And this language is a language that I studied. I don't expect many of you did. And the same way I don't understand maybe your language, this is hard stuff to understand. And this pandemic really has challenged even us as scientists and doctors in terms of our normal understanding of disease and disease spread. Sorry, I'm going to try to be quick. As a pediatrician, my role is clear in this community. I am an advocate for children, period. In medicine and science, when I'm deciding with any of you or others on a treatment or recommendation, I am calculating in my head benefit versus risk. No prescription solution or treatment comes without risk. Please hear me. I am not up here to tell you that COVID-19 does not have risks for pediatrics. However, by the way, there is never any such thing as no risk. However, I am here to tell you that when analyzing risk versus benefit, the scientific evidence is mounting that shows that COVID-19 is not a pediatric pandemic. For the most part, kids are not contracting, spreading, or significantly suffering from COVID-19 itself. It can be safely assessed that the risk of COVID-19 in children is significantly less than the academic, social, emotional, mental, physical, and nutritional benefits of in-person school. In fact, in many parts of our countries and others, kids have been in preschools, daycare centers, large centers during significant outbreaks, and they have not had significant problems or contributed to significant problems in the outbreak. Make no mistake, here in the U.S., here in our county, we are failing our children in our response to this pandemic. I am already witnessing the heavy toll that this is taking on our children. Not the virus itself, but our inability as a society to cohesively respond to it and to acknowledge that it even existed. Some children in our community are now faced with hunger, despair, solitary confinement, neglect, abuse, and in some cases, deportation to other countries to avoid the prospect that a parent has to face of leaving their child home in an unsafe environment while they go to harvest our food. I am not talking about refugees in a third world country. I am talking about real kids, real circumstances here in Merced, California, United States of America. We should be very ashamed of ourselves as a society. We prioritized our reopening in a way that has now left us crippled and no choice but to delay reopening our schools. Months ago, our experts sitting behind me in the health department outlined in great detail the protocols necessary to reopen schools safely. The governor has now outlined protocols, and he has given us parameters with which we can get our county under control and consider restarting based on those metrics.
Doctor, you have just a few seconds to.
Okay, I'm sorry. I do want to publicly commend one private school in this town, Our Lady of Mercy School, that from the start has embraced distance learning and has now made every modification possible to their school to meet those protocols. I just want them to be looked at as an example for how to do this and do it correctly. They've even changed their drinking fountains to hand washing stations. I suggest that every adult in a decision-making capacity please put politics aside, work together and to ensure that our schools pre-K through 12 are ready to go as soon as we can meet those metrics. Unfortunately, there are 3 metrics that I also want you to pay attention to: the teen suicide rate, the teen pregnancy rate, and the teen dropout rate. Again, by being in denial about this pandemic, we have now failed our kids. I own that, we must own that, and we must work together to make it better. Thank you. Oh, and if any of you have any questions about the science of this or the pediatric component, as you go on making your decisions, I am ready to answer those questions.
Did you bring a card, Doctor? I know we can Google you, but that's okay.
I
Thank you.
literally ran out. Yes, no, those are my husband's cards. I'll get them to you.
Thank you.
Thank you.
Thank you. And I do.
If you're subscribed to the channel already, you might want to check and make sure you're still subscribed so you're notified whenever a new video goes live. And subscribe if you're new. Until next time, this is the gardening snail of Livingston, California, because not every critter is hiding under a rock.